So PRP injections are starting to become a bit more mainstream, despite still not really being covered by any insurance companies. But there is definitely a lot more people who are waking up to this idea that our only options for treating, chronic pain from an orthopedic standpoint is physical therapy, cortisone injections, or surgery. And with that, we are starting to see a huge influx of information and questions about PRP in the orthopedic setting. So I wanted to take a few minutes here just to answer a few kind of common questions that I get, whether it's from patients, potential or current, or just through social media, to hopefully help you guys understand this a little bit more. So the first question is, what is PRP beneficial for? So when I'm asked this question, the general things that I think about are, one, what do we see in the research? And two, what do we see in the clinic? Understanding that things in the clinic, we're going to see things in the clinic well before the research supports it. And that is a little bit backwards compared to, what we generally see in the medical community. The medical community is generally such that physicians don't implement new therapies until they have been proven, proven in quotation marks, because there's always caveats with that, but until there is solid research behind it, to support that. Now, that doesn't matter for surgery because there actually isn't randomized, blind, clinical controlled trials until or before they actually implement a new type of surgery or a different approach to surgery. And so we can disregard that. But generally what happens is we wait for the research and then we implement a treatment in the clinics. But when we're not in the insurance model and we are in a situation where we're looking to help solve the problems of patients who are not getting the results that they should be getting or that they deserve from the other treatments that are available, then we start to get into this realm of we're doing things that might be a bit ahead of the research. And then we use that to inform the research on how we can make better research articles and research protocols. So that way we can prove and quantify the things we are getting. And so the big things that I see PRP being beneficial for is our chronic degenerative conditions, okay? Those are things in a nutshell are where we have tissue degeneration. Now, with PRP, we don't always 100% get actual regeneration of the tissue when we look at it under some form of imaging, whether that's ultrasound or an MRI. However, a lot of the times we actually do, which is really, really fascinating to see. Even in those cases where we don't see tissue regeneration, the PRP is still beneficial for a lot of those patients because we are changing things that we can't necessarily see on the monitor, right? We can't see it on an MRI, a CT, or an ultrasound, and maybe one day we'll have imaging studies available that can shed light on that. But right now, we just don't have that. And so our chronic degenerative conditions that generally we see better results with, in the research we have knee osteoarthritis, we have lateral epicondylosis or epicondylitis, and then we have, we're starting to see some really good results for rotator cuff tendinopathy, and then a little bit on the patellar tendinosis, patellar tendinopathy. Clinically, what I see is I do see those. So knee osteoarthritis, PRP can be really beneficial. We see it for our lateral and medial epicondylitis or epicondylosis, a more proper term, rotator cuff tears. And then in terms of the patellar tendinosis and Achilles tendinopathy, which both of those in the research are kind of hit and miss, our clinic personally has been seeing much, much better results with those when we incorporate a fat pad injection. And so for patellar tendinosis, we're actually incorporating an injection into the infrapatellar fat pad, which is also known as Hoffa's fat pad. And in the ankle for Achilles tendinopathy, we are injecting into what is known as Kager's fat pad. there aren't any research studies incorporating those types of injections for those conditions. So I'm really excited for the future to see what happens in the clinical setting when those are incorporated in with the patients who are non-responders to the traditional approach with just treating the tendon and the enthesis, which is where the tendon attaches onto bone. And so those are, and then, things like facet arthropathy. So facet arthritis, we see really, really great results with. My approach for the cervical spine in patients who are having cervicogenic headaches, which basically means headaches that are a referral from the cervical spine, which is usually going to be the facet joints. We've been seeing really, really outstanding results for a large majority of our patients. And again, I believe that's because we're adding in additional injections with the traditional approach of just injecting the joint. We're incorporating treating the nerves, the ligaments, the tendons, and kind of just the supporting structures around the joint. So that's what we see PRP being beneficial for. The next thing that we get asked a lot, because a lot of patients can't travel out to see us for injections, are what should I ask my doctor in regards to this PRP injection that I'm going to have? And generally, these are the things that I say. The first is, what type of imaging are you going to use? Notice how I frame that question up. It's not, are you going to use imaging? It's what type of imaging are you going to use, whether that's ultrasound or fluoroscopy. I'm a huge, huge believer that if you are paying the money and putting in that investment into receiving an injection like PRP or autologous stem cell therapy, that you really need to be having this done under imaging, because the level of accuracy is just so much higher in those cases. There's a lot of published research showing the success rates of actually getting inside of a joint when you use palpation guided, when you use ultrasound guided, and when you use fluoroscopy guided. And by far, while there are some joints, that are relatively similar between all three, the subtalar joint actually being one of those, there are some where it is vastly, vastly different. So for example, the success rate of highly trained MD interventional pain doctors for getting inside the hip joint from an anterior approach is 50%, okay? So the top tier physicians who are doing these types of injections have a 50% chance of getting inside your hip joint when you have that injection done. So if you're not working with one of these top tier physicians, because there isn't one around you, then the chances are going to go down if they aren't as skilled. And so when we add in that ultrasound or that fluoroscopy, that increases that back up to, I believe it's around 95 to 98% accuracy. And there's actually been a few studies for the hip that show 100% under ultrasound and fluoroscopy. And so that's one of the big things. The next thing is you want to be asking them about how much concentration they're going to have in their PRP. And so the current research shows us that we are looking for anywhere between 4 to 6x in order to have a minimum effective dose for the PRP injection. And so one, if your physician doesn't know what the concentration is, that can be a red flag that you might want to be looking for someone who understands the research a bit more. And that can just help you to find the right physician to start working with, essentially. And so if they don't know, then that's a red flag. If they use a kit that doesn't give them 4 to 6x, so maybe they get 2x, then that might be something that you have to consider. Is this going to be the right physician for me? Again, just because of how much literature there is behind this 4 to 6x increase in platelet concentration that we're looking for. Those are probably the biggest two questions that you're going to want to ask the doc that you're working with as you're trying to make this decision if you're going to move forward with a PRP injection. And then the last question that I get quite a bit is how we can make how a patient can make the most out of a PRP injection. And the biggest things that I tell patients in this regard is all of that comes back to building a strong foundation of you as a human. So that's things like eating well, staying hydrated, sleeping well, getting exercise, and having social connections or a hobby or some other type of purpose in life that is going to result in you being a healthier human as a whole. So that way, when this stimulus comes to your body in the form of a PRP injection, you're able to respond more effectively because you as a human are healthier. And so, we're looking at things like not eating foods that are made in a factory, aka processed food. We're looking at drinking half your body weight in ounces per day. We're looking at sleeping 8 or 9 hours a night, basically enough that you are not waking up tired almost every day of the week. Moving, exercising, getting some heat shock therapy in the form of sauna, just something to get your muscles engaged and activated 3 to 5 times a week. And then obviously auditing the people in your life and removing those who are negative influences and who are continually bringing you down, because those are not positive social connections. So those are kind of the top 3 questions that I get around PRP, and I hope that helps you guys to get better results when you're working with your provider for helping you to get out of pain. See you later.